Hello. On behalf of Scientific Committee of Global Rhinology Network, I'm Ashok Rokade. I'm a consultant rhinologist and skull base surgeon from Royal Hampshire County Hospital in Winchester and University Hospital, Southampton. I welcome the colleagues around the world. I know you're joining from different time zones, and I have with me my co-host, good friend, consultant rhinologist and skull base surgeon again from Australia, Sydney, Raewyn Campbell. So welcome, Raewyn. Although it's a morning for me, it's I have to say good evening to you. And you can see Raewyn had just finished a very busy skull base list. What did you have on the list, Raewyn?
Well, thank you for the welcome. I actually had a very large frontal sinus osteoma that was huge, actually. So I do apologize. I've been drilling for a few hours, but it's wonderful to be here. And yes, it's evening my time. Welcome, everybody.
Okay, great. That takes us straight through our first book. And it's no secret because it is a book related to the frontal sinus surgery. So, Raewyn, you have been associated with Global Rhinology Network since our inception. We started our event Grace 2020, and you are very much part of it. And everybody still gives a great feedback about your talk on chronic rhinosinusitis management in children specifically. So, Raewyn has another interest about sinusitis and rhinology, pediatric rhinology as such, apart from her adult rhinology and skull base work. So yeah, great to have you on board, and thank you for agreeing to join this event. So Raewyn, as you know, the Global Rhinology Network, we are really an organization of like-minded surgeons. We came together, Christos, Anshul, right from the beginning, they're all part of it. And we developed this platform, and our mission is to foster the professional development in our field. And it is freely available to all. And I'm really proud to say that right from our first event, the delegates from nearly more than 100 countries have joined us. And even today, I've been informed by the studio that delegates from nearly 50 countries have joined us. So which is a great news. And today's event is really a one-off event. And it's one of its kind because we're discussing the book. I'm not aware of any live book review session in our field conducted before, and we're really looking forward to it. So we have chosen three very interesting books, very relevant books that have been published recently. So the one book is related to the sinus surgery. So as you can see on the screen, the frontal sinus, the surgical approaches, and controversies. And I personally was I got the copy of the book. I personally was involved in writing one of the chapters. So thanks, Anshul and Christos, for the invitation. So we're joined today with the two authors of the book. Is Professor Anshul Sama. Anshul is from Nottingham, UK, one of the premium frontal sinus surgeon in the UK. And he has really taken this frontal sinus surgery to a different level, contributed hugely to training in the UK. And Christos Georgalas, he is from Hagia Hospital in Athens in Greece. He's a professor of rhinology from Nicosia University. And again, he has immensely contributed to the field by its various books in rhinology and the frontal sinus surgery. So the book we're going to discuss today is The Frontal Sinus, Surgical Approaches, and Controversies. So over to you, Raewyn.
Well, welcome both of you, and thank you very much for writing such a fantastic book. I apologize, I think my image has frozen. First of all, I just wanted to ask you a couple of just general questions. First of all, what decided to write a book on the frontal sinus in particular?
Sorry, it just got cut out a little bit. Could you repeat the question again for us?
Hello?
Hello, I think, sorry, there seems to be some technical...
hopefully you can hear me now. I'm writing this book on the frontal sinus in particular.
So so are you asking what brought us to think about writing on particularly the frontal sinus?
Yes,
correct. Yes, if you can hear me,
perfect.
That's what I'm asking.
So
yes.
I think there's a slight delay, which is apologies for that. I think Ashok worked with me more than 15, 20 years ago. And at that stage, it was quite obvious to me that the frontal sinus in sinus surgery was kind of the last frontier. Between from the 1990s to 2000s, sinus surgery, endoscopic sinus surgery really boomed and developed exponentially. But it was quite evident that even at that stage, the frontal sinus was always a bit of a challenge. And I think I was fortunate enough that at that time, my colleague Nick Jones supported me, and I did manage to do a lot of frontal sinus work. And from that, I collaborated with Christos over the years, and we thought that this was definitely a very valuable contribution to the literature, to people's understanding, which is why we wrote this book, really. So both Christos and I have been passionate about this area. We both contributed over the years to conferences and courses in this area. I thought this was a culmination of our thoughts to bring it together into a single entity as an access. What do you think, Christos?
I think you are very humble. Actually, it was Anshul's idea to write the book. He came up with the idea. And I think, it was a great idea. We had a good time writing the book together, but it was his idea. And I think to a large extent, it was based on the success of his course. He was running a frontal sinus course, and we could all see that it was very popular, that there was a huge demand from a lot of people wanting to learn more about the surgery and the anatomy of the frontal sinus. So it was only the next logical step to put down the experience and the controversies and what we discussed at every course. I'm going to Anshul's course now for 6 or 7 years, to put it in paper. I think that pretty much sums it up. And there is a large interest. People are writing about the frontal sinus. They're trying to operate. It used to be a very niche area. 20 years ago, when I did my training, one of the advice was, unless you absolutely have to, don't touch the frontal sinus. This is how I was trained. And then gradually, it became more accessible. And then it became part of the full house fairs. It's not a standard, but a pretty much, let's say, almost standard part of a complete fairs. So this evolution, I think it was presented in the writing of a book that would combine all the information and videos together.
Yeah, it's certainly the most difficult sinus in lots of ways. It's in front of where we are, it's above where we are. You're kind of operating backwards when you are operating, and it's probably the most complex and the most unforgiving, I think, of all the sinuses. At least that's my experience. Ashok, I'm sure you find the same. I get that there's a couple of things I was wanting to talk about. There are a few sort of things that we're traditionally taught about the frontal sinus. One is that if you need to get lateral to the midpoint of the orbit, you can't. Is this something that you find is still traditionally taught and something that you still believe in, or now with modern techniques? I find that we're sort of able to get beyond the midpoint or the mid-pupillary line.
I'll let you answer first.
I answer this because I find it's a very good question. It's something that actually I have thought about it a lot. Some years ago, I think more than 10 years, there was a paper from the team of Richard Harvey about this, about accessing the roof of the floor of the frontal sinus laterally. And it was concluded at that paper, if I remember well, I mean, excuse me if I'm misquoting the paper, that it was impossible to access the most inferolateral part of the frontal sinus, the roof of the orbit. And then there were some papers, a lot of papers about the osteomas specifically, deciding at various points different limits for the endoscopic axis. One, at some point, the limit was the medial wall of the orbit. At another point, it was the papillary line, the vertical line in the mid part of the orbit. And we thought about this. I think it's not straightforward. I think that one has to consider anatomy. And actually, we did an anatomical study, a cadaveric anatomical study, and we found that the intercanthal distance, the interorbital distance, predicts the angle of attack. The more, in other words, the more apart you have the orbits, the more space you have between the orbits, the more laterally you can access the frontal sinus. And then again, of course, is the issue, the orbital transposition technique developed by the team of Paolo Castelnuovo, which again allows you to drill out the medial part of the lamina papyracea, take out the anterior sigmoid artery, and then push the orbit laterally, and in which case you can access it. So I think, depending on the anatomy, depending on the technique you use, what we are learning, it's very hard to be dogmatic, to say you cannot reach beyond the midline of the orbit. I don't think it's an accurate statement. And that's one of the reasons we wrote the book, that there are different opinions, and not one opinion is it's the right one, right? Unless you're talking about some very extreme cases. In most cases, you can have 5 rhinologists, and then you would have 5 different opinions about the same issue. And it only makes you richer the more you learn about them. That's actually, talking of the book, that's the last part of the book, Controversies, where we asked the authors to describe, to talk about issues which will raise controversy. One of the chapters, actually, is what you just mentioned, the extreme lateral lesions that our friend Jem Mecho has written. And how do you access the most lateral lesions? What techniques you have? And I think it's one of the things.
Sorry. So this is the fun about the frontal sinus. I mean, see, you go to any sort of sinus surgery course, even we have a GRN webinar series, which have been added to the GRN Academy. And there's all the useful source. You will find there as well. The frontal sinus is very, very popular. In the courses, people are very keen and passionate about learning about the frontal sinus. And right at the beginning, we have really landed into this interesting discussion and controversies about the management. That's the whole thing about the book. So there are lots of books about the sinus surgery. There are quite a few books now getting published related to the frontal sinus. So what do you think special about this particular book that makes it stand out?
Anshul.
Okay. Ashok, I think one thing you'll notice is that, as the previous conversation, what is the standard of care and what can be achieved is progressing as we speak. What can be done, lateral limit, what is achievable through a unilateral approach, what pathological entities need an open approach. All of those things are changing consistently. And yes, work has been written on this, but it is progressing ever so quickly. So the book really recaptures the essence in 4 different kind of stages. First one is obviously anatomical, which is re-establishing the understanding of the anatomy and the challenge that this area creates. The second is really the endoscoping and the open approaches. It tells you all the different types of approaches to the same entity, because there is never one perfectly right approach. You have to have multiple different ways of doing the same procedure to be able to identify what's the right thing to do for that particular case in front of you. So you cannot have a one process for everybody. And that equips you with that aspect to actually educates you about all the different processes. And the last one really talks about conditions and the controversies. So different people will approach the same entity in different ways. And the book lays down what is the current understanding and then presents you the controversies of where the gray areas are, where things are going to change. So I think it's in that way, it is quite unique rather than dogmatically saying this is the only way to do it, which has traditionally been the ethos of a lot of the thought processes and the teaching in the past, that you do the frontal sinus in one way. We at the course and the book very much talk about that everybody has a different approach, and it's a method of learning, a process of learning as widely as you can to get the best outcome for the person in front of you, the patient, and anatomy, the pathology. So I think in that way, the book is unique in what it brings to the table.
Okay, so that's interesting. So looks like you have made all the efforts to accommodate different views and approaches on the frontal sinus surgery. So the reader can then choose their, learn from all and choose what suits them the best and delivers the results for them. But then how did you go about getting these opinions together? So essentially what I'm asking you and Christos, so how did you go on choosing your authors and contributors to this book?
Christos, I'll let you answer that one.
Well, there was not the same way for the different chapters. In some chapters, it was only obvious to us that someone who has published, or even, for example, the team of Varese has developed the orbital transposition technique. So, and it was only natural that they would write about it in the same way that teams who had a big academic and presence about an area, even in congresses, in terms of presentations, then they would have to write. And don't forget that with Anshul, we have been going to a number of congresses over the last few years and courses. So we pretty much know what each author, academic rhinologist likes to talk about, what he's good at, what he's... having said this, there were also some chapters what we had to find someone to write about. It was not very obvious. And we were very lucky to have a very keen, very kind authors who, without any exceptions, took over our suggestions and they developed them. Sometimes, you know, there is something, someone has his pet subject, and sometimes they may have to write about something that's not so close to their heart, and that I think testifies to the kindness and the generosity of our authors, that they were able to write excellent chapters in whatever we would, let's say, throw at them, ask them to write. It's a matter of selecting high quality academic and clinical rhinologists, I think. I don't know what's your feeling, Anshul.
I think Christos put a lot of effort into this, and I must thank him for fronting that aspect, is actually collaborating with and putting all the different chapters and the authors together. I think he summarizes very well. You have to go to the opinion leaders because they have a level of understanding that assimilates not only time, pathology, but also the variation that occurs. And we were very cautious about people just stamping their way onto it, which is why we introduce different authors with different opinions to the chapters. But finding the opinion leaders and then making sure we cover all the very unusual factors. Open approaches are not that common. Talking about Riedel's procedure, not many people are undertaking that procedure right now. And actually to get somebody to authoritatively summarize that chapter is a challenge. And as Christos said, we were fortunate that there were some people who were forthcoming who actually took that challenge on and still presented to us a very up-to-date approach to something that is potentially historical.
I guess I wanted to ask you a couple of questions. There were one thing I noticed is traditionally in Australia, we're taught, look for certain anatomic features. But I see you have this look precisely up mnemonic. I don't know if I can't remember exactly which chapter that was in. But it was a different way of looking at all the different anatomic considerations when you're in the frontal sinus. So laminar papracia, the insertion of the uncinate, the olfactory recess, ethmoidal arteries, and middle turbinate, etc. Is a different way to what I've always learned and I've always been taught. I'm not sure if, I mean, I know it's an enormous book and multiple different authors.
I remember it. It's from Claudia Kers.
Yeah.
The radiologist that actually we used to work together with Claudia when she was in London, and 20 something years before. Claudia Kers. I think she worked at Gray's Inn Road, and she's an excellent radiologist, and she has moved now to the States. She's working in the US. And I think it was her idea. It's her way of codifying the radiological anatomy of the frontal sinus. And to be honest, it's not something that I was used to, but I think it's a very clever way of mnemonic, of remembering these structures. Exactly. CL, I think it's the acronym mnemonic for, I don't remember, the look precisely up. It's the uncinate process, the laminar papillaceae, etc.
Yeah, look precisely up for an accessory cell, ethmoidal arteries, and be mentally trained. And it's just looking for all of those anatomic features, it's very comprehensive. But it also, we've never been taught this before. So I thought that was really interesting.
It's one of the things. You see, Claudia, I think she's American. She worked in the UK, then she moved back to the States. And her presence in the book and what she wrote testifies to this, how can I say this? International aspect of the book, how the same people can appear in different countries and with different experiences, and they can mix it all together, and they can bring up something new and interesting.
Yeah, I agree. I thought it was really interesting. The other, sorry, Ashok, I didn't want to jump on it, but I noticed the other great thing is the fact that you did cover the as you were saying before, Anshul, about the Rydell's procedure and things like that we just don't. But I also wanted to talk to you about all the different evolution with the different flaps that people are using in frontal sinuses. And or free grafts or nothing at all with different dressings.
I think it's a fascinating, this is the development. This is the development in frontal sinus surgery. We've gone from making big holes into making accurate holes into actually making sure the holes stay open over time. And actually, Ashok may remember that even when we were working together in Nottingham, I got him to look at a series of an unusual flap that I had constructed from the septal window. Even at that stage, it was apparent to us that simply creating a big hole does not equate to a good procedure. It's the functionality is so important. And what is interesting is over the last kind of 10 years, a variety of different flaps and processes have come into play. And actually that is very similar to what you said. In Australia, you've been taught to approach the frontal sinus in a particular way, or a certain anatomical landmarks you look at. You move over to Europe or to US, and then you approach the same issue in a slightly different manner. And the key thing about the book is to actually introduce everybody to the different ways of looking at the same perspective from different perspectives, the same thing from different perspectives. And therewith lies the fact that this is still an ongoing science. I think this whole concept of migrating functional mucosa into position to make the frontal sinus work is an ongoing science. I think we're seeing a lot of development in it, and the book covers all these different types of flaps because there is never actually the one way. Sometimes you will find that it's easier to raise a particular flap because the mucosa on the roof of the nasal cavity and the septal area is actually completely full of polypoid disease. So you have to then start to look at recruiting from another area, or even considering a free flap. To have all of that options considered actually improves your perspective, widens your perspective. And that is what is required, because anatomically and physiologically, this is a very challenging area to master in endoscopic surgery. And as you quite rightly said, that it is very unforgiving. If you don't get it right in this area, it does fester and become a problem in the long term. So the flaps, in my opinion, is the next concept moving forward. And then we will move to actually, how do we get appropriate medication into this area appropriately so we can manage the pathological processes in that cavity? So I think this is still work in progress. And I hope the book really encompasses all the different types of approaches with the flaps that have been considered.
So that's great, Anshul. I mean, I can see that you got a lot of these interesting topics covered in the book. So any more of recent developments, the future developments that are likely to come in that have been included in the book that you discuss in details? Any specific areas, Christos?
Okay, I mean, I think what Anshul said, that the flaps, the chapter on the flaps, I think written by the team of Philippe Herman, it's a very good example. The evolution, I mean, surgery of the frontal sinus will mean surgery including flaps from now on. It will be, it's a one-way street. That's definitely the future, I think. 10 years from now, we'll be looking back and thinking about just drilling into the frontal sinus to be as, let's say, awkward as just doing a Caldwell lock. People will not do it anymore. We'll always try to protect the mucosa and to apply the mucosa flaps to the mouth. Another thing is that the chapter on robotics, Paul Breitfeld from Technical University of Delft, Paul Breitfeld, he wrote an excellent chapter on miniaturization, miniaturizing the instruments to use them in an attempt to create a new kind of robotic manipulation to the frontal sinus. And I think he introduces some very interesting concepts, both about the surgical approaches in the frontal, also about the difficulty of miniaturizing instruments and maintaining 3-degree freedom of movement when we enter that area. Other chapters that I find interesting is the chapter about, I think that Claire Hopkins co-wrote on the use of the balloon sinoplasty, which is a very controversial area. And it's an area, let's say, where there have been a lot of studies, a lot of research, and still we are not certain. But she presents in a very balanced way the available evidence. And I think she does a very, how can I put it, a very objective overall review. And it's very difficult because it's a very polarized area. People are either for or against balloon sinoplasty, and it manages to maintain a balance, which I think is good. Obviously, the chapters on malignant tumors, the chapters on papilloma are very good chapters. It's difficult to select. The surgical chapters, the video ones, I think it's one of the best, probably, if not the best, one of the best parts of the book are the videos. So the chance to look at the videos, scan on the photo, use your iPhone, your phone, your mobile phone, and scan the QR code, and then you can have the video playing. I think that's, I've never had it in a book before, and I think it's excellent. I don't know. What is the part that you like?
So I think that's really a very exciting addition to the book. So that's really, we are taking the books, the print books, to a different level, and we see that the glimpse of the future in this book. Apart from this glimpse of the future of the technology like robotics, then discussion of various controversies, various new things, new developments coming in the field of frontal sinus surgery. So, is there anything about biologics in the book, Anshul?
Well, I think
that's quite a hot topic.
it is a very hot topic, and it's ongoing topic, and that's definitely, as I mentioned, that's where the development really is going to be happening in the future, is to look at not only surgical approaches, which is what we've talked about, but also looking really at the biologics. And I think that is still work in development. That is still the role of biologics in sinus surgery, is getting better footing and getting a better understanding. But I do not feel that we particularly have a clarity on its specifics in this area. Obviously, drug-eluting stents, etc., are very important armatorium, similar to the balloons and other structures, other additions. But I think this is work still ongoing, and this is the future of where frontal sinus is going as well.
Yes, that's interesting. I mean, however, we would like to discuss the various clinical aspects of this topic today. Our readers are also keen to understand about the authors. So it's a monumental, phenomenal task getting a book of this magnitude through. I know both of you how busy you are in your clinical practice. So we'd like to understand, how long did this take for you? What were the challenges from the inception to the book coming into print?
I think anybody who's written a book,
so.
I think anybody who's written a book, the biggest challenge is not the conceptuality. It's actually, everybody is very, very busy. And to try and get the right people to write chapters for you is step one, but actually get them to deliver is always that much more difficult. Our concept, Christos, my concept, is always universal. It's got to be a global book. It's a book that assimilates, people's opinions from all the continents across the world, so that we actually have representation. And that in itself presented its own challenges as well. I think hats off to Christos, because he did put a lot of effort in this area and process to actually ensure we keep our authors updated and make sure that the chapters are updated. So by the time the book comes to print and publication, we're not out of date. And that was quite difficult, quite challenging, and hats off to Christos to actually to keep pushing. So it's a combination of emails, coaxing, phone calls, and it did eventually take us about 3 years to deliver on the project.
Well, thanks, Anne, but it's not me. I mean, we work together on that. The point is that the authors themselves were not the problem. The authors were very generous, as I said, with their time, and very willing to participate, and very good with their timekeeping. But when you have to remember that there is a lot of logistics around the book, and that includes the publishing house. There was a change in terms of the the local editor. It was which was collecting the chapters together, and there was a new editor that came on board, and we had to. So there were some logistic issues, let's say, not from the author's part, from the local editors, that probably delayed, and for that we should probably apologize to the authors to the extent that we delayed the printing out of the book. But it does take, that's true, a lot of trying to juggle many balls in your hands, trying to do many things at the same time, and a lot of persistence. At many points, we did think of that maybe the book will never come out. We did think the book will never come out. It's true.
So from there, my recent personal experience, I would very proudly share with both of you that I've been to a few meetings, and you visit the book stalls there, and this was probably one of the most popular books, and one of the meetings, it was actually out of stock. So certainly from that point where you had doubts whether the book will really see the print, from now it's one of the most popular books. So when you're planning to write this book, what was your thought process about how do you get the layout of the book? How do you create the sections of the book? I mean, our readers would really like to have that insight in the author's mind. So, Anshul, you want to?
I think the the key that is really the structure that you create to the book, and the thought process and the concept is you've got to take a step back and say, what are you trying to really achieve by this? Because there can be a lot of Me Too books and processes out there. And hence you've got to step back and say, what are you really trying to achieve? What do you want to say? And that remains your key first principle. Now, key first principle Christos and I agreed on is one, a global concept of every different perspective to approach this sinus. And that went from anatomical, pathological, physiological. We wanted to encompass all the different perspectives into one area. And then when we looked at all of those different categories, eventually we realized they fall into certain boxes. And that's how we structured it. So we structured the first is anatomical, is fairly well defined. People have slightly different approaches to the anatomy, and that's important to take on board, but it's a defined structure. The second was the large expansion in the number of different approaches and techniques: orbital suspension, midline approach, septal approach, lateral to medial, medial to lateral. And we wanted to be sure that we encompassed all of that in the armatorium of how you could approach this sinus endoscopically and open. And that created the section number 2 and 3. And then we knew that there is a large area of, you will potentially, so as you know, my philosophy is anatomy plus pathology determines what procedure and approach you're going to take to this, to frontal sinus. Because you may not do the same approach for a malignant disease versus a benign inflammatory disease. And we wanted to bring that to the table, which is the section number 4, which was really about, the 3, which is the different controversies about management for specific pathological conditions. So from inflammatory disease to inverted papilloma, so that the reader could have a perspective from a pathological process. Controversies was very important for us because there is no right way, and people have polarized opinions, and it's valuable to understand the foundation of those polarized opinions. That created the next section. And then lastly, where are we going from here? And that was very much a vision from Christos there, where we talked about the robotics and all the other new technologies coming into this area to kind of paint the picture of where we're going here. So it was a identification of what are we really wanting to present to the reader, and then being able to decipher that into different sections so that we could encompass it in a more systematic manner.
Thank you. I mean, that's really insightful. And if I may ask both of you, yes, this is one of the very popular books. I personally refer to it a lot. There's a lot of learning in it, and our readers are getting great benefits from the book. But during the process of writing this book, do you both yourself learn anything about the frontal sinus? What was your own learning from the book?
Well, for me, to be honest, I'm taking the part on the. I can be very, very precise. I know that the part on the flaps, I have been using it when the book came out in theaters. I've actually had the book in the operating theater, and I was looking at the sketches, planning for the flaps, something that I did. Honestly, something that I did myself. Although I had the book, I knew about the flaps, and I had to take it into theaters, and I had it open and looking at the diagrams of the flaps of the frontal sinus. Definitely changed my practice. But I mean, all the chapters, there were things that I learned about, from the drug-eluting stents, which I'm now using, I didn't use in the past. It's difficult to separate. I don't know, Anshul, which part?
I think I learned loads, huge amounts. Now, you invariably, although you know your colleagues, you know their opinions, or you know the literature, but actually you still are slightly blinkered by your own practice and your own approach and your own philosophy. And what this book really presented to me was really the opportunity to systematically look at everybody's opinion and philosophy as well. So I learned huge amounts from the book, just purely by understanding how everybody else looks at the same process in a slightly different manner, approaches in a different manner, which tells me one of the principles that I always talk about is, you can scratch your ear like this and you can scratch your ear like this and it still works. So it's fascinating to learn. And I think I still learn. I go to conferences, I listen to people, and I always come away with one or two really interesting novel ideas that I never thought about, or an approach or a perspective I never thought about. The book, for me, was like a Christmas of thoughts and perspectives, because I had to read them all the chapters, and that actually disciplined me to listen and hear all the different opinions and principles. So for me, it was an astonishing learning curve. Even though I'm passionate about the area and I feel I knew a lot about it, I learned a lot reading people's perspective, and that's brought me to a different platform. And that is in the hope, similarly, we hope that other people will be able to use the book to actually raise their platform by understanding the different perspectives. That's the ethos of what the book's about, is to be able to give you really different perspectives to approach the same problem, not be dogmatic about there is only one way.
And I guess the thing that's different with textbooks is you're writing these for a very long period of time. I'm sure that both of you don't really want to have to rewrite this in 12 months' time, etc. So it's a very different philosophy to writing a paper or something, and you've got to have those key principles, and you're covering things a little bit differently to what you would if you were writing a paper on a specific area.
Yes.
How did you go about choosing the content such that it would last as long as possible? That's what I find difficult with textbooks.
I think nothing lasts as long as possible.
Yeah.
But it is the chapters are the different topics are honed such that these are controversies that will develop. And yes, maybe 5 years' time, we'll look back at the flaps chapter and say, actually, this only now is about 25% of our practice. We've developed a lot more. But based on the fact that these entities will not change. How you manage an inverted papilloma in the frontal sinus remains a category that will always be developing, but it will still be the same concept. We're still managing inverted papilloma. So I think the book is structured in such a way that the foundations won't change. Maybe in 5 years' time, the content becomes different or develops, but the foundation of what we're presenting is actually will likely to remain the same. And that creates something that can be built on over time. I agree with you. We're not looking to review the book in 12 months' time, but there will come a time when we feel that actually the literature and our understanding has developed that the book can now be, re-edited, updated, and that would really, we can use a very similar framework still.
Absolutely. Yeah, especially
I'm sure.
In 10 years' time, that might be stock standard, but it'll be interesting to see. Thank you.
So time for the second edition. Thank you so much. Thank you so much. I mean, it is important that to have your insights into this book, and it was so helpful and so wonderful sharing of your ideas. But I think our readers are the key to the book. We can write a fantastic book, but at the end of the day, we need a reader to utilize that book. I think it'll be interesting to hear their perspective on this. So we have joined here today by one of our readers of this book. Can I invite Rohit Gohil to the studio, please? Rohit is a consultant skull-base surgeon, rhinologist from Edinburgh. And we have also good friend Edward Hajianas. He practices rhinology in Cyprus. So welcome, Rohit. Welcome, Ed. So Rohit, how did you decide to choose this book?
Hi, good morning. I hope you can all hear me. Firstly, I just want to say thank you for inviting me to be a reader on this platform. And secondly, I just want to congratulate the authors on this monumental feat in putting together this brilliant book that we're discussing this morning. So it's a very good question. What was it that drew me to this book versus any other on the subject of frontal sinus? And I think a lot of these points have been covered already. It's contemporaneous, it's current, the way that it's been delivered, the way it's been collated in such a way that it provides a trajectory. It starts from basic science. It gives you an anatomical basis, a physiological basis of the health and disease of the frontal sinus, and then takes you on a journey through surgical techniques, endoscopic and open. And I found that quite refreshing, that actually a portion of the book was dedicated to open approaches and their very real relevance in modern times. And then moving forwards, it allowed me to actually form more opinions, more of a balanced opinion in different controversies. And I enjoyed the final part of the book where those controversies are actually, discussed quite openly. And it allowed me to actually have open discussion with my registrars and my colleagues on how to manage tricky cases originating in the frontal sinus. So in all, yes, I chose this book because it collates all of these features that I wanted in a reference text on this otherwise very complicated subject.
And have you found the videos helpful or the diagrams, for example, as Christos was talking about with the flaps, etc., for teaching, as a teaching tool?
No, absolutely. The diagrams and also the endoscopic images in this book are of a really good quality. So it allows you to get your point across to your learners. I have enjoyed the fact that this is a very modern book. It's got QR codes. You can link in to additional resource on the internet. And those videos have been very helpful. They allow a translation from the written word to something quite physical there in front of you to refer to. And it just allows you to get a more broader and more rounded understanding. So the videos, I feel, are essential, but also it's the way forward for any future textbook to include this kind of media in it.
So yeah, thanks, Rohit. Edward, I mean, you practice in a kind of a different, slightly different setting in the UK. Edward practices in Cyprus. So he has this advanced rhinology practice there. So it's almost the status of frontal sinus surgery, I guess, is probably not that advanced, not that well developed. So how did you find this book useful to you in your setting, in your practice?
First of all, thank you for the invitation as well. And congratulations to the two authors, actually, that have come up with this excellent book. Just to say that, yes, I do have an interest in rhinology myself. I'm not by any means, an expert rhinologist and even an expert in the field of frontal sinus surgery. But in the context of sort of practicing general otolaryngology, I did find that this was a book with a content that sort of helped me to expand on this. As we know, there are not a lot of books that are focused solely on the frontal sinus and the treatment of pathology that occurs in this particular region of the paranasal sinuses, whether it be conservative or surgical. There's a relatively small group of ENT surgeons, even among rhinologists, who will attempt to touch this area surgically. So a person actually needs a book that can both provide him with a broad, a complete overview of the topic and also give him the opportunity to go more deeply into specifics if he so chooses. it's a book which, of course, has been written by Anshul and Christos, who both great enthusiasts of the topic and have devoted, or rather are devoting their lives to learning as much as they can about rhinology and endoscopic sinus surgery and skull-base surgery. Both of these specialists are considered to be, well, I would say world authorities nowadays in their respective fields. And in addition, there are in the book well over 100 more contributors, as far as I could count, to the various parts of the book. And some of these collaborators are legendary people, actually, and significant inventors in the industry, such as Paolo Castelnuovo, Peter Wormert, Ricardo Carau, just to name a few people that spring in mind. The other thing that was quite special to me was that the book is organized extremely thoughtfully into a variety of categories, each of which contain pertinent chapters and are beautifully illustrated with diagrams and photographs. But yet, as mentioned before, the most, I would say, groundbreaking aspect of this book is undoubtedly the accompanying video clips that it has. I have to say that it's such a luxury to be able to sit or sort of lie down in bed just before sleep. That's what I do sometimes, and to have your phone with you and be able to see the video clips, reading the book at the same time. And I think that's extraordinary. Perhaps I would like, if you asked me, to see more videos actually in this particular book. There were already a lot, but if we had a few more, I think it would have made it even more interesting, especially in certain chapters. I know that some of the chapters, that they have, is very difficult to apply this to, but still.
What sort of things would you like to see more videos on, just, for next edition?
Yeah, I think my favorite kind of chapter was the one with the surgical techniques, the endoscopic surgical techniques. So I think I would like to see a little bit more of that, and perhaps even associated with a bit of a commentary. Some of the videos, they did have the commentary, some of them didn't. But it's such a luxury, as I said before, to be able to read and at the same time just see what the surgeon is doing there, and you get a different kind of feeling. Yeah, I think, the other thing is that as far as I'm concerned, it made it possible for me, as I said, more of a general otolaryngologist, to look at the frontal sinus with more assurance, rather than considering it more of an untouchable section of the group of the paranasal sinuses, and to approach its pathology with more resolve. So it convinced me to, in a way, make an investment in more appropriate gear and equipment to approach the frontal sinus, and that was something that changed my practice to a certain extent.
There's certainly the more interesting of the sinuses. They're thicker in women but larger in men. They're the last to develop and often won't develop. 15% of the population don't develop one. People with chronic respiratory conditions like primary ciliary dyskinesia or cystic fibrosis may not develop them at all. They develop at different rates in different ages, and also between males and females. So they're kind of interesting as well. As you said, they're the ones that often are feared the most. And I guess having a textbook like this with videos, with QR codes, with diagrams that you can have in the operating theatre, I think that does us a great service.
Absolutely.
Yeah, great. Thanks, Edward. I think that's fantastic to understand from you that this book is not only useful for niche frontal sinus surgeons, but even for general otolaryngologists, even for people, the surgeons who have standard sinus surgical practice, the book has its value and it's useful. So thank you for putting that perspective in, Edward. Now, next question is to you, Rohit, and probably one of the last questions for this book. You're a young consultant recently appointed. You're taking this frontal sinus surgical field into Scotland. So does this book make you feel more confident when you are suddenly on your own dealing with these complex cases?
That's a really good question. I think there are a lot of factors when you transition from being a trainee registrar fellow to an independently operating consultant. And one of the many things that gives you the armor of experience is the training you've had, but also keeping up to speed and keeping current. And a book like this is excellent to have by your side, to have on your bookshelf to refer back to. I do feel that in a topic such as frontal sinus surgery, which is always taught in general FRCS ENT as being, you know, the last bastion of sinus surgery, endoscopic sinus surgery, that there is a general worry about operating in that area, and that's something that needs to be overcome. And so although the book is essential, it's a good thing to have by your side, I think it also allows you to cement ideas and concepts that you learn through other means as well. So in addition to the book, going to the relevant courses, attending conferences, but also just adding to the research base as well, having, you know, a say in what's going on and moving things forward. I think all of that adds to gaining a fuller understanding and experience, because we will ultimately always be students in this topic, in this subject. So the book is incredibly useful, and I think it does act as, you know, something to help consolidate your learning in addition to everything else.
Thank you. That's excellent sum up, Rohit. Yeah.
I have a final question for the authors, Ashok, is Christos and Anshul, do you feel we need a book for each sinus? Not to traumatize you both.
Sorry, I'll unmute myself. Very interesting question. Thank you for that. I think if you look historically, there were a lot of books written about the maxillary sinus historically. And historically, that is where we concentrated our practice. The frontal sinus was something, the reason this book came about was the same reasons we're hearing, in that it has always been considered the last bastion. And the challenges presented that by this particular sinus is slightly different to ones by the different other sinuses. So I believe that, would I say that we need a book for every sinus? Probably not. I think the approaches to the different sinuses can be quite variable now. And even if you root back to the maxillary, I think we've now got a wider approach to that same concept. But I do think overall, most of the sinuses behave together with a few exceptions.
Thank you.
Okay. Yeah. Thank you. So I think that was fantastic to hear from you, both Anshul, Christos. Our delegates have surely got great insights into your thought process while this book was being written and what the book actually involves. We heard from the readers as well that what benefits they are getting from the book. So thank you. And this was our first book. And I think there comes a time now that I have to say that the GRN has no conflict of interest with the publishers. So it's not book promotional event, but it is getting the value of the book to our readers and understanding the importance of this book in our current clinical practice. So thank you. This event.
Thank you very much.
Yeah.
Thank you very much for both of you and GRN to take this on. Really appreciate it. Thank you.
Yeah. Thanks, Ray. Thank you. Thank you, Edward. It's great to see you.
Thank you. Thank you very much.
Thank you.
Bye, Ashok.